When a patient has an infection or is thought to have been colonized by certain pathogens, healthcare workers follow specific infection prevention and control practices. Wearing personal protective equipment, or PPE, reduces the risk of infection for patients and other healthcare workers. Before using PPE, assess the patient and review his medical history to see if isolation precautions have been ordered. If so, review them to determine which barriers you'll need to use. Then perform hand hygiene. Assemble all the equipment you'll need to care for the patient. Then prepare to enter the isolation room. If you'll be wearing a gown, put it on first, followed by your mask or respirator, goggles or face shield, and gloves. Make sure the gown covers all of your outer garments. Pull the sleeves down to your wrists and fasten the Velcro or tie the top string securely at your neck and waist. If the gown is too small, use 2 gowns. Put the first gown on like a coat and tie it in front, and then put the second gown on in the usual way and tie it in back. Then put on a surgical mask or fitted respirator. The type of mask you select and whether fit testing is needed will depend on the type of isolation precautions being observed for your patient. Before using a respirator, medical evaluation and fit testing are required. Your goggles or other eyewear should fit snugly. If you wear prescription glasses, you can use a face shield instead. Apply clean, unpowdered gloves. If you or your patient has a latex allergy, the gloves should also be latex-free. Bring the cuff of each glove over the edge of the gown sleeve. Enter the patient's room and arrange your supplies and equipment near the bedside. Introduce yourself to the patient and his family and explain why isolation precautions have been ordered.
I need to check your ID band, please. Can you tell me your first and last name?
Jonathan Smith.
Your date of birth?
6/27/57.
Thank you.
Give everyone a chance to ask questions.
What is he on the isolation precautions for?
He's on droplet precautions for influenza illness. It's a respiratory type illness that's spread through droplet exposure from one person to another.
And how long is he going to be on the isolation?
He'll be on isolation until he's discharged from the hospital.
Okay, thank you.
All right.
The patient may be lonely, bored, or depressed. Be alert for such emotions, particularly if your patient has a decreased appetite or is having trouble sleeping.
Any questions that you have about the isolation precautions? Okay. I'm going to take your temperature. Is that okay?
When you finish caring for your patient, let him know when you plan to return. Ask if he needs any personal care items and offer to bring new books or magazines to help pass the time. Follow your healthcare agency's policy regarding the disposal of contaminated equipment and supplies. Remember to close the door when you leave. Removal of PPE follows a specific sequence: gloves, eyewear, gown, and finally the mask. Remove your first glove by grasping the cuff and pulling the glove inside out over your hand. Hold this glove in your gloved hand. Then slide the fingers of your other hand under the remaining glove at the level of your wrist. Peel the second glove over the first and discard them in the proper container. Now remove your eyewear, face shield, or goggles. Handle the item by its headband or earpieces and discard it appropriately. Now remove your gown by first untying the neck strings or releasing the Velcro and then untying the back strings. Allow the gown to fall from your shoulders, touching only the inside. Pull your hands out of the sleeves without touching the outside of the gown. Hold the gown inside at the shoulder seams and fold it inside out into a bundle. Discard it in the trash or linen bag as needed. Your face mask comes off last. If the mask is secured over your ears, remove the elastic and pull the mask away from your face. If the mask ties on, untie first the bottom string and then the top string. Drop the used mask into the trash receptacle, being careful not to touch the outer surface of the mask. If the patient is under airborne precautions, your mask or respirator should be removed outside of the patient's room for your protection. When you leave, remember to close the door. A closed door is required for patients under isolation precautions or in a negative airflow room. Then perform hand hygiene. Follow up by documenting any procedures you performed and note how the patient is dealing with his isolation. Also, document any patient education you offered or reinforced.